Hi, welcome you to our presentation on acupuncture treatment part 8. In this video, we give you some points to consider before going to any practitioner. This is a product of captureideas.com. Finding an acupuncture practitioner is much easier now that it is much more common means of therapy. You can find one the same way you find a dentist, by simply looking on the internet, in the phone book, or asking one of your friends that is knowledgeable about this current health advances. There are several national acupuncture organizations on the internet, and you can look up your locality by state and city. You can also ask your family physicians, for more and more doctors are referring their patients to an acupuncture clinic for the treatment of certain problems. You might be even more surprised to find that your doctor or internist may have training in acupuncture themselves or one of the associated therapies. Once you find several acupuncture practitioners in your area, you should make sure to check their credentials. This is always a good idea for you to do for all your health support team, from your internist to your dentist. Not all states have established training standards required for acupuncture certification, but if yours does, ask the acupuncture practitioner about their training, background and certification. An important thing to note: although a certification does not ensure an excellent practitioner, you are at least assured that they have had sufficient training in the area. Do not rely on your practitioner to diagnose a disease unless they have conventional medical training. An acupuncturist is well trained to observe and address symptoms, but the Chinese medicine behind acupuncture is not particularly concerned about naming a specific disease. If you have significant symptoms that you feel needs a precise diagnosis, rely on a trained doctor. As mentioned earlier, your doctor may encourage you to seek the services of an acupuncture clinic to address certain symptoms that you may have. Once you have found out the background of the acupuncture practitioner, the decision to select one is similar to the decision that you use to select a dentist. You may have friends that recommend them. You may schedule an initial visit and see how you feel at the office, etc. The remainder of the decision is more on how comfortable you feel with the acupuncture practitioner. The initial visit will consist of diagnosis, where you will talk at length with the practitioner, and that will give you a very good indication of whether you are comfortable or not. The cost of the treatment will be discussed after the diagnosis normally. The number of treatments will depend on the set of symptoms and one's overall health. The acupuncture practitioner should discuss this before the series of treatments starts. Some symptoms only require a few treatments, whereas the others may stretch over a series of weeks. Typically, the physician along with the acupuncture training will charge more than the non-physicians. Insurance companies may cover visits to the acupuncture clinic, but one should contact them first and then discuss their individual case. Make sure to mention whether it is a referral from a physician. This introduction must have hopefully given the information needed to confidentially find and schedule the first acupuncture clinic visit. Now we come to Panic Away program. This is for anyone who has ever felt the terrifying grip of a panic attack. For anyone who feels like the only person in the world facing the scary bodily sensation of anxiety. For anyone who has ever sat with others and feared that the panic would force you to exit quickly, feeling embarrassed or ashamed. The approach here is very unorthodox. It developed from my own personal experience, ending an anxiety disorder many years ago. For anyone who has anxious thoughts and feelings that you cannot share with anyone else. I should dispel some of the myths that you may have read about anxiety. You might have heard people say things like anxiety and panic are mental illness. Once you have an anxiety problem, you will have it forever. You have to take medication to end an anxiety problem. People with anxiety should just try harder to snap out of it. None of these are true. Let me give you my opinion on the current treatments for anxiety. First of all, I find almost 95% of the information and advice out there on treating anxiety to be at the best ineffective and at the worst harmful to people who want to end their anxiety problem. People are not being taught how to empower themselves and end their problems. Instead, they are taught ineffective coping tools and exercises to muddle through and get on with it. No one gets results for people. They get the results for themselves. It is the people who apply the program and do the work that deserve the praise. So, what is my solution? It is actually quite simple, but it takes a few reads to get your head around it and then apply it. In essence, people should know how to stop struggling with anxiety, to stop resisting it, and to transform it. To read more on this subject, visit my website. I have given the link below in the description area, or you can even type captureideas.com/panicaway. This concludes our presentation on how to find an acupuncture practitioner. In our next part, that is the part 9 of acupuncture treatment, we discuss about how does an acupuncture practitioner diagnose.